Well, 2020 was certainly a year of change and difficulty for so many people. And although our world is opening back up, it's still far from normal for some people. The uncertainty can take a toll on a person's mental health, especially our children. And this morning we want to talk about a program that was recently expanded to include our youngest population. Here with more now is Melissa Birdwell, Children and Youth Division Director for Frontier Health. And Melissa, welcome to Daytime.
Thank you and good morning.
It's good to talk about this. I think so many people still, it's just been 2020 was that year of, the pandemic and then the unrest within our country and a lot of internal unrest.
Absolutely. Unfortunately, mental health services are desperately needed at this point. We have seen numbers increase of people who are reaching out for help for things like anxiety and depression in numbers that we just hadn't seen in the past.
And so the wonderful news is some resources that were previously available to adults now available to children as well, because I think it's harder to find those services and ask for that help when it comes to kids.
Yes, unfortunately children had been left out in the pilots that started with adults, but now we can expand to children as well, so we're very excited about that.
Wonderful. Well, let's talk a little bit about the program. It's the Tennessee Safety Net.
Yes, it is Behavioral Health Safety Net, which is actually a program through Tennessee's Department of Mental Health and Substance Abuse Services. And the program was started, as you said, for adults back in 2005 as a way to make sure that we could break through some of those barriers that people often have when they're trying to get mental health services. So with Safety Net, it's designed for people who are uninsured or underinsured to be able to afford the services that they need. And thankfully, in September of 2020, we were able to expand the program to include children.
I think that's so wonderful because we talk about, that physical health, which is so important, but mental health before it was almost considered a luxury.
Absolutely, and I would say it's a necessity versus luxury, yes.
So having this available to kids now in our population, how do they take advantage of some of the services? What does it all cover?
So Safety Net isn't actually insurance, it's just something that supplements and covers the services that are needed. And those services can include a range of things from individual, family, and group therapy or assessments and evaluations, case management, medication management, transportation assistance, or pharmacy assistance.
Wow, so it covers a lot of different things.
It does.
Melissa, how do you know if it's something that you can help your child through, or if this is something that, maybe I need to go ahead and see that there's help available?
Sometimes you can look just to see if there's changes in your child's behavior or other changes that you've noticed that you're just not sure how to address, and you want somebody to help you walk through that process. And that's what we're here to do, to help families to walk through the process, to give children an outlet for some of the stressors that they're feeling, and for the parents to have assistance in knowing how to work with their kids and to talk to them.
And I think the stigma is finally starting to turn around. Parents, I think before, were afraid to acknowledge that, maybe my child does need some help. And now I feel like we've come a long way to say, that's okay. We all go through things where we're going to need some help at some point.
Absolutely. It is not a sign of weakness. It's a sign of strength to be able to ask for assistance when it's needed. And we still have a long way to go to completely get rid of the stigma around mental health, but I think we've certainly come a long way already. That it's something that can be normalized, especially after this year that we've had where so many of us have been impacted in one way or another.
And Frontier Health is sort of that agency that has really stepped up, and it's the one that's part of this program.
Yes, so there are agencies across the state, but locally Frontier Health is the resource provider.
Okay, so how do our families get in touch? How can they reach out and learn more about this program?
I would encourage families to call their local Frontier Health office, but if they're unsure of who that might be or how to call, I would direct them to check out our website, frontierhealth.org, for a list of locations and contact information. And with Safety Net, we also have an outreach coordinator whose name is Caitlin Sturgill, and Caitlin serves the entire region, so they can always reach out to Caitlin at 423-361-7183.
And that funding is now available to help those families.
Absolutely. It is available. We are ready to serve them and help them sign up.
Wow, wonderful. Well, thank you so much for joining us and helping
You're
us
welcome.
sort through it all. Here is that website that she mentioned. If you don't know, or you can go ahead and call this number right here on your screen, and they will direct you to the person that you can speak with to get the help you need. The preceding portion of Daytime Tri-Cities was sponsored by